pushed it along a little bit.
Well, and it's not even like you're not manipulating people, but you're trying to let them see the positive reasons behind this. And if they ask about the negative, you tell them those as well, because you want them to be well educated, you want them to make their own decisions. But at the same point in time, like, this is what we need to do, this is what the doctor wants you to do. I don't really want you to be in the ICU forever. Like, I would prefer that you go home and have, a healthy life than stay here with me. And that's why I want you to do these things. So that, and I am on the patient experience team at work, so that we have to do a little bit of marketing for that, and flyers and posters and, raffles and stuff like that to help our nurses want to give better patient experience. Because sometimes people get complacent and feel like they can cut corners, and you don't need to explain things to the patient, and I'm just gonna do my job, I'm just here for 12 hours, and and that's not the type of nurse you want to be. That's not the type of nurse you want to be. And sometimes that's when people are experiencing burnout.
Yeah.
And in that case, they may need to take a little bit of a vacation. But, you want the patient to have the very best experience, even though they're in critical care. You want the family to have the best experience. You want your hospital to be the one that they refer to other people.
Right.
So, there's always business mixed in with everything. I guess it's my final word.
My background was, I was in sales as well, but my first degree was speech communication with an emphasis in Spanish, or an emphasis of a minor in Spanish. Hello. And I do the same, with educating. I don't get to see families, because they don't get to see their families very often either, but I don't get that. That's what I miss, is in a hospital setting. I missed, being able to calm down a mother, or explain something to a mom or a dad or a brother or sister, whatever. I really miss that, and that's something, the way communication is huge. Throughout the board, whatever job that you have, it is important that you can communicate, not only with your patients, but multi-D. You work with doctors, you work with x-ray, you work with lab, you work with, I work with the warden, you work with whatever, everybody is there for that patient. You are the number one patient advocate when you're that person's nurse, but you pick from everybody, and they all are there to ensure that the care is.
Right.
So you need to be able to communicate with the doctors, with the nurses, with PT and OT and everything else that's going on with that patient as well. So being able to communicate in a whole, professionally and with the family and things like that, that's very important as well. You want, think of it as if you were in the hospital, how you'd want your family to be treated, or you'd want to be treated. That's how you want to treat your patients. And I know it's hard, trust me, I know it is hard at times. You are, you got forced, or you're tired, or whatever. But the people that they remember the most when they leave a hospital is their nurse. Promise, they will. And if you are bad, they will definitely remember it. Or if you're mean to them or bad, or they're not happy, that they'll remember it.
One of the best feelings is having a patient or a family say, we want you to be our nurse. Is there any way that you can be like the nurse for my father, or, my daughter, whatever their loved one is, tomorrow? Are you going to be back tomorrow? And you'd be like, well, I'm not back until, and they're like, well, can we request you? Oh my gosh. That just makes you feel like, man, I really touched this family, I'm really doing a good job. Or when you get, I got a note, and it was, we do this pat on the back board where we as coworkers can say, thanks for going above and beyond. Thanks for doing this extra, you didn't have to, but let me give you a pat on the back. It's kind of like a high five, but for everybody to see. I had a note, I walked into our break room, and I had a note from a patient who was a Spanish-speaking patient, and he didn't really speak very much English. I think he had cranie with tumor removal with one of our surgeons for cancer. And this program is so great because, okay, you have your iPod, right? So I always wanted to find ways to use technology to help me out. I don't speak Spanish at all. at all. Like, and so even if I could like translate it, I can't say it. So I found an app on my iPod, and now I use it, and it's on my iPhone, and it's called Free Translator. But I actually bought the part where it says it will play it out loud. So the only thing is I can only do like yes or no questions because I can't understand what they're saying back. But, but I can say like, are you having pain? And I understand numbers, so like, can you tell me how bad your pain is from 0 to 10? Like, and I use that, and then we also have like a translator service, but for some reason on nights they don't like to.
I don't like to send them out.
They don't like to pay for an interpreter or the translator service overnight because they figure the patient's going to be sleeping. Although I still have to do 3 assessments and, you know, make sure that the patient's okay, make sure he's not having a headache, make sure he's not bleeding into his head, all those things. And there are some questions that I would like to be able to ask him. So I use this app. And the first time I found out about it was with my iPod Touch. So, but he wrote a note, like his family member wrote a note, and I walked in and it was on the board. And it was just saying, thank you for your amazing care. You know, may God bless you, and you're a wonderful person. And I was just like, oh.
Yeah.
Because it warms your heart, because it's just like, you know, a lot of things that we do go unnoticed.
Yeah. Yeah. One thing that I was going to say with that, my environment, I don't get thanked a lot. No, not because of me. Not because of me. Because it's a different type of environment. And but when they do thank you, it is very, very heartfelt. Because, you know, that's why we thank your peers. Say, oh, great job, you know, thank you for helping me out with that chart, or thank you for doing that. We get our support system. I mean, yes, you thrive off. At the hospital, it made me feel great. But remember, if somebody does something extra for you that you work with, and you never, ever, ever, ever want to be the nurse that's like, well, you're an LPN, so go do this, or you're a CNA, so go do this. No, we are nurses. We are all nurses, and we can all do, you know, we are trained to do a CNA's job. We are trained to do an LPN job. We are trained, we will be, you know, you will be trained. So if you can help out your CNA or your LPN, they will love you for it, and they will be right there when you need them. It won't be well, I guess she didn't help me out last night, so I guess I'm gonna go help out the other nurse. They will be there for you. They are your people, and you're a team. So that is one big, huge thing that I can say. Another thing, I think Tom told me this. I think what he told me was, and I remember this over and over again, knowing everything doesn't make a good nurse. Knowing where to find the information is what makes you a good nurse.
And that kind of goes back to the beginning. You will not know everything, but you should know where to find it. Yeah. Or who knows where to find it.
Right.
And sometimes I walk in and I'm like, what is that? Google, it's your
Yeah.
You can misspell it on Google,
Davis
and
Drug Guide,
and it will still say, did you mean?
Yeah. You're not going to know every med. You're not going to be, you're not going to know, you know, as much as they'd love us to know every med in the farm book. You're not going to remember everything. You might remember, you might have heard of it. All right, furosemide. Oh my gosh, I don't know what that is. But you've heard of Lasix. All right, you know, so it's, yeah, there's so much, you can't even remember one, like there's so many indications and doses and things like that in just one medication. How are you supposed to remember hundreds?
Oh, funny story about Lasix. Oh my gosh. So I had this one patient, and this gentleman, I think he had a chronic catheter at home, but he was in with a UTI. So obviously they wanted to take out the Foley. So they're in the chart. This is when we still had Turner, so we still had paper charting. We just switched over to Epic, which is there's no paper anymore. So in the chart it goes, remove Foley, place Foley, remove Foley, place. And so everyone keeps going back and forth about this. But in the end, he needed the Foley out, and that was the final say of it. So they took it out, but because he has a chronic Foley, he does not so much know like when he has to go, and so he was incontinent of urine a lot. So the doctor comes around and he's like, well, what do you think? And I'm like, well, I kind of think that we're fluid overloading him, but at the same point in time, like, I can't tell you what his INOs are, because all I can tell you is that I've changed his bed 7 times, and every time I go in there to turn him, like, he's wet, and we're getting him washed up. We've changed his linens, we've done all of these things. And he's like, well, if we're fluid overloading him, then I guess we need to give him some Lasix. And I'm like, oh no.
Oh, yeah.
If it wasn't bad before, it's gonna be bad now. And so I go, well, I know that you guys don't want to Foley, but is there any way I could have an order for a condom catheter? And he's like, oh yeah, sure. I'm like,
You could ring the sheets on.
yeah. Oh yeah. And so he asked me about it, and he goes, well, how much Lasix do you think we should give? And at first I'm like, 10. And he like literally laughs to the point, he's like, ha ha, 20. I'm like trying to take it easy on myself, because I know I'm like, that's when I was like, can I get a condom catheter? And he's like, yeah, sure, And so I got the condom cath on too, and so at the end I'm like, this one, I'm like, yes. Yeah. And he's like, you do this for a condom cath? I was like, he has been incontinent of urine. I can't tell you how many times. And this patient's on contact precaution. So every time I go in there, I have to put on a gown and gloves. And
oh man.
And I was in there a lot. And every time we come out of the room, the IV wants to beep, and you're like, I was just in there. Seriously, like, what is beeping now? Why are you bending your arm? Oh, but I mean, so that's my funny story about Lasix and my condom cath, my fist pump.
Yes.
Yeah.
Did you go directly into the ICU, or did you have to go to like a step-down unit or a floor?
I went straight into the ICU. My last clinical was in the ICU, and I was just really, really very, very lucky. I got a letter of recommendation from Dawn, and I got recommended by my preceptor, and I had worked with a lot of the charge nurses, and they all recommended me. And I wanted a full-time position, but I didn't. I think that they hired someone else for the full-time position, but they hired me for the position that's like one less shift than being full-time. And then by the time I got off orientation, I was full-time. But yeah, it stars aligned really well for me.
We were discussing last night about who do you have to talk with about this kind of thing? Like, we're at the dinner table and there's, people are talking about all sorts of body fluids, and, you can't just do that out with, your in-laws might be like, what are you doing? But who is your, like your collegial support? Is it a lot of work people, us? Yeah, it's going to be us. And then the other thing I wanted to know, and that kind of relates off of that, is in my previous career you got a lot of support and development and just that sort of, I guess it'd be support from like associations. So are you guys in like ANA or Wisconsin Nurse Association? And what sort of things are there? Like, we had conferences that you could go to. Like, it was like just science teachers. And so you could get all sorts of development and be able to talk about teaching science and not have the person next to you fall asleep because they don't really want to talk about mitosis and how you taught mitosis and meiosis, all those kind of things. But so are there a lot of opportunities as far as, and did you, so I want to hear, how did you take advantage of those?
The one that I joined straight out was Sigma Theta Tau, the Honors Nursing Society. Okay. So I joined that one, and now I'm a member of ACCN. Yeah, I joined that for my job. But that also gives me a discount for when I'm taking my CCRN, so that's another reason why I joined that. But who do you talk to about this? I talk to everybody about it. Like, I will talk to, like, when I was studying, I would talk to my husband, and I'd be like, let me tell you about this. And he'd be like, I have no idea. I was like, I'm going to explain it to you, because I learned through explaining too at points in time. And he's like, okay, so just talking about it out loud would help me. Or my mother-in-law is a nurse as well. So that was very helpful for me. Or, your preceptors, or, but your greatest resource, who do you talk to about it? I mean, right here, you're gonna be, like I said, set up a group Skype, but if it gets like, at one point our group Skype got a little bit like, I got a little uncomfortable with it, so I like backed out of the group because people will vent.
Mhm.
That's fine. You have your 5 seconds, do your thing. After that, let's move on, you know? And maybe don't vent on the group Skype, you know? Like maybe just pick one person, talk to
Yeah.
them about it,
Yeah.
and then move on from there. Because you'll have frustrating moments, but
Yeah, and nobody understands it like you guys.
Yeah.
Nobody understands it unless they're going through it.
yeah.
There's no way. Nobody can get it. To answer your question, I am going to a conference to become a Department of Corrections nurse. There's a lot of different outside opportunities. I've been to several trainings in Madison, several conferences where it's kind of cool actually. I get to learn like what the correctional officer, it's called security for non-security staff. So I get to they teach how to like protect yourself, like by using hand movements and things like that. So that's kind of neat. But like people are fascinated with nursing and nurses and medicine in general. You're gonna have people come up to you, like when you say you're a nurse, like I said, they're like, oh, you're a nurse where? Oh, awesome. What's the coolest thing you've done? Or what's the, I mean, I have many stories. And people want to know, they're interested in it. And I think, nursing, I think a lot of people are like, they always wanted to, they always have, like, medicine and nursing in general, I think, they all have this real want to know, but a lot of them are afraid to actually like get in and do it. So they get like their satisfaction from hearing the cool things that we do.
Or they're like, is it like Grey's Anatomy? Or
Yeah.
like, no.
I mean, I get asked all the time, tell me something cool. All right, here you go. And they're like, oh, that is cool. Or like, oh my God. Or it's kind of like I don't know how to explain it. It's just, people are fascinated with nursing and medicine in general.
So you did find, so you said you're attending a conference, and that's actually gonna get you like a certificate or something?
Yep.
Okay, so they're supporting it?
Yeah, there's many different kinds of conferences that you can go to and do, and a lot of employers, like, they'll pay for it, and, it's for ongoing learning or, that kind of thing, so, yeah.
There was a conference recently that I was trying to get my job to pay for. It was a stroke conference in Hawaii. I'm on the neuro team. I should be at this conference. They're like, no. Sorry, you're not going there.
Yeah.
It was a really good try. I was pitching it. And then there's NTI, which is really awesome, and that goes on every year, and they pick a different location. I think this year it's in Boston.
What is it? What
There was-
NTI
Yeah.
is what? Does that stand for? Oh, okay. Okay.
It's all about teaching and learning,
Yeah.
and best practice,
Mhm.
and it's pretty much like nurses from everywhere come together and like not just share stories, but like new devices
Right,
or
new developments,
and
that kind of thing.
best practice.
There's a lot out there,
New
though.
evidence-based practice, and you learn different things. I haven't been, and I was actually going to try and go this year, and I didn't. I guess I needed to write an essay, but that week for work for me was pretty busy, so I didn't write the essay, and I'm not going. But I'm going to go next year if I'm still.
I'm sorry. Go
No,
ahead.
sorry.
Go ahead.
You had talked about you were on a committee at work, and in my previous career too, there was like everybody, well, not everybody. It seemed like some people did all the committees, but there was a lot of, do you find a lot of opportunity as far as, which I think is great for networking, is in both, I guess I'm curious too, in corrections too.
Tons.
For tons still. So committee opportunities, growth opportunities.
Tons.
I actually have a friend who is a charge nurse, and she's on like a systems committee. She writes policies. She does ACCN, which pretty much makes sure that we're following compliance. And she's trying. Actually, I'm supposed to join ACCN, but right now I'm the secretary for a patient experience team, and I don't really want to spread myself too thin because I actually do need time to study for my CCRN. But I was thinking about joining that one too because. I mean, it's important, and you get to see things that you thought of be implemented, which is actually really cool.
Yeah.
And then you said like, oh, who do you talk to about body? Well, you know, body fluids, and like we're sitting around talking about, well, you will talk about body fluids all the time.
Yeah.
They're like, oh, you know,
Not even real.
you know, oh, this
Yeah.
patient has a T-tube and like it's like dark brown and like, oh, like, or like, oh my gosh, I just got projectile vomited on, like, like I mean, you become really comfortable talking about that stuff, and
It's hard for me too when I text. This is so weird. When I text, like, S is without, C is with, I will text that to my friends, and they are like, what are you talking about? Like, and now they get it, because, but like, you live, you breathe, it's nursing. That's what you do, that's who you are. And it's so weird, but yeah, I text that or like, change. I'm like, where's the triangle? I'm like, oh. Yeah. But yeah, there's tons of opportunities for communities or committees for us and corrections as well. Yep.
Back to making an online program work for you. I've done some online classes which really weren't that hard, and all my other classes have been in person, and I'm the type of person who, as I'm going through the lecture, if I don't understand something, my hand is up because I need to understand before I can hear the rest of the lecture. Now, that might not work in here, but how did you manage to make that part of this program work for you?
I'm the same way as you, or at least I was, and I was definitely afraid of the online thing. I liked to be in class and raise my hand and talk. Imagine that, you know, like with my peers and everything like that. But with the online, there are so many, you know, some people can learn by hearing, some people can learn by seeing, you know, whatever. And the online, you have your book, and then you have your professors, and you have, they do, what was it called? PowerPoints. You have PowerPoints that you can print off in whatever way that you feel comfortable or that you want, and then the podcasts. So what I would do was I would print out the PowerPoints, thank you. I would print out the PowerPoint, and as I was reading, I would also, highlighters and those little tabby things, you know, that you, like, those would be your friend too. I used a ton of those, and when I'm reading, if there's something important, like, and they'll be very helpful for your tests as well. Like if you tab, you know, say you know you're having a test on INO, you can tab and you can just open right to that page. So that the tabbies are they really help me. The highlighting really helped me. But utilizing all of those resources, that really made it kind of full circle for me. And it made it like if I had a question, I would come up with a bunch of questions, like, you know, I'd be like, oh, I don't understand this. Okay, now I don't understand this. And I would Skype Tom or Dawn or Bonnie, or I would have my list of questions. I'd be like, on page 57, it says this. What does that mean? If you're organized, and I'm not saying that they won't help you at all, but if you're not organized, but if you are organized and you can pinpoint exactly, you know, in this book, on this page, what does this mean? They can open it and they can explain it to you. So being organized in that manner was very helpful for me too.
not only, like, I completely agree with that, but you can, like, have a different color tab for when you had a question. Like, okay, I'm gonna tab this page red because I need to go back to this and I didn't remember this. Or, like, let's say you have a question you feel like you can't go on without having that question answered. That's why you have your Skype.
Mm-hmm.
Like, 9 times out of 10, somebody is on.
Yeah.
And
They
even
really
though
are.
you may not understand it, it might be like, clear as day to someone else. So you can say, I had kind of a study partner, Sarah, so I was like, hey Sarah, did you understand this? And then maybe she understood that part, or maybe she didn't understand it, but she was like, oh no, but Wendy did, and I talked to her about it, so maybe reach out to her. So you have this network of resources.
Definitely.
In regards to skills, I have a nurse that just started on our floor, who's a brand new nurse, and she had never started an IV before and said she had no opportunities to practice while she was in school. And so I was just wondering, during boot camp or during clinical, with preceptors, will they allow you to have that practice time, or do you even have time to do that?
Oh yeah.
Okay.
Yeah, actually I had a preceptor who let me try and start an IV on her.
Yeah, I do.
So, and like I offered to Robert, and like the other day, he said he hadn't started an IV. One of the Excel students is doing his last clinical in the ICU now. And I was like, I mean, I don't have the best veins, but you can try. I will let you poke me. You can get 2 pokes.
Yeah. One thing is that I was starting IVs constantly, like when I was, when I had gotten good, well, not better at it, or when I had learned it. But one thing that if you want a skill, ask. Let everybody on your floor know that you are a student, and let them know, or let your nurse know, or your preceptor say, oh, hey, if something's going on different, or, if somebody needs a cath, can I do it? Or, so everybody knows that you're a student and that you want those opportunities. If you want to start an IV, ask, and they probably will let you. If you need to let them know where your comfort level is as well, too. But a lot of the times, they'd be like, all right, students on, catheter time. All right, sweet, yes, I get to do something. Like, and it's so rewarding. It's so like, I just put in my first Foley today. Like, you just walk around and you're like, oh, I took a blood pressure by myself. I was nothing afraid of. I was so afraid of blood pressures when I got here. I was petrified. And now, like, it's night and day. But you have to congratulate, and you have to, like, every little milestone that you do, every class, I had a blown up, like, the schedule, and every time we finished a class, I would highlight it to show your progress, to show, that you're accomplishing something at one time. And I always did that, and I loved that. I like checking stuff off. Yeah. And you gotta celebrate. Hey, I put in my first Foley today. That's awesome, and everyone's gonna look at you and be like, yeah.
I think I was like super stoked because my first clinical, it kind of sucked though. My patient, or one of the patients that we had, coded. So
my first patient coded.
Really?
First clinical day ever. Yes. Yes.
So like I got to do chest compressions, like, and it was during my first clinical. So that journal entry was like 3 pages long. And I was like, oh my gosh, I was on the chest. And then I was up in the bag, and then, like, he made it off our floor, like.
I didn't make it off the floor.
He did. We brought him back like 3 times. Like, we coded him for a while, but then I think this was when I was on a medical surgical floor, and I think he coded again right outside of that, like, right getting off of the elevator for the ICU, and the family was like, okay, like, maybe this is enough. Like, I'm sure he's got a bunch of cracked ribs.
Did I understand that, from what you were saying, that you are a nurse preceptor now?
I am not right now,
You're not.
but I am willing to take that opportunity.
Me too.
I had a student the other day because his preceptor wasn't there.
Oh,
and so I paired with him, and and then whenever there's a student and I see like Oshkosh, I'm like, yes.
I know,
like,
I love that.
If you need anything, please ask me, or if you, want to come look at stuff in my room, or, I know you have a skills checklist, like, what can I help you with to get that done? Because getting things accomplished on there is huge. Like, at the end, you want to have it done.
Yeah.
You want to be able to present this during your interview, like, these are the skills that I can do, like, I have this, we had all of these skills to do, and I did them within a year.
Yep. But I've precepted before, just kind of like in the same boat, that there's one woman that she's the designated preceptor, she's been there 20 years, so that's, her thing. But I get to like interject too. And I love seeing UW Oshkosh students there. It makes me so happy because I'm like, and then they're happy too because then they're like, wow, you really know what I'm going through? I'm like, yep, whatever, so.
Yeah. And then I think I gave like flashcards away.
Yep.
I've given like I gave like a bunch of stuff away because every time I see Oshkosh student, I'm like, oh, like, you're almost done. Like, how are you feeling?
Right.
Like, aren't you excited? And they're like, yeah, I'm a little tired, but I'm like, but it's okay. Like, let's get some coffee. Let's talk. Like, okay, like when you're done, like checking out your patients, if you want to like look at mine, or if you want to take a listen, this is really cool. This patient has crackles. Like, hey, come listen before I give this Lasix. Lasix skin. And then, like, I don't know, it's really, like, it's like a community. And whenever you see someone else from Oshkosh, you're just like, yep.
Yeah. It's like it's like one of your, like bind, like you're just kind of brown, like to them, you
Yeah.
know, like you've been through the same thing, you're doing the same thing, so. Yeah.
I had a quick question. Can you guys, both of you, how's your average day when you're doing your didactic side and stuff? Just kind of break down your study routines.
I'm not a morning person.
I'm not either.
So I would burn the midnight oil. So I don't know, like I would stay up. Sometimes I'd be up at like 5 in the morning, like, and I'd be posting, and my friend would be like, "I just saw you posted. Are you up at 5?" And I'm like, "Yeah, I'm about to go to bed after I post." But I would get up, and I'd pretty much have it laid out what chapters I wanted to get done that day and what assignments I wanted to get done. And then I'd double check and make sure, like, I would read other people's posts and see if there's anything that I could contribute to group discussion that day. Like, I try and get that part done. And then, I start my coffee and I'm like, on my computer, I open up Skype and I'm like, all right, I'm going to start reading. So then I'd read and take notes and do that stuff throughout the day. I don't know what time I'll wake up. Like, I can't give you a specific time or anything like that, but I would just kind of alternate between reading and posting. And then like, okay, maybe it's time to take a break and like, let's maybe work on this other assignment that we have going on for a little bit.
I would get up, I had a routine. I would get up, and I'm not a morning person, but I did this. I got up at 9, which is, that's pretty early for me. But I would get up at 9, and my first thing that I would do is post. Because I think you are required to do 2 posts or 3 posts, something like that. And I wanted to get that out of the way. Smack dab done. Out of the way, get it done. Then I would read, then I would post again. Like, it would be like, I was always one of the, and you see the patterns of people. It's funny, like who'd be posting at 3 in the morning, who'd be like the first poster on there. And the thing is, if you post first, you get to like start the topic, which is really fun. So, but you can finish it, which is really fun too at the end. So I mean, and you get a really good discussion with your peers. But I would get up at 9, I would post, do my reading. Like I said, I would alternate, or like you said, I would alternate in between doing my posts and my reading. And then, honestly, probably about like, I would do that, get my posting done, get everything done, make sure I was prepared for anything the next day. And then probably around, depending on the day and if we had any exams or anything, probably around 6, I'd be done for the night. And I could, have dinner with my family or go shopping or do whatever I wanted to do.
See, I never had that.
I did. I was so afraid. That's why I keep stressing. And it's different for
It's
everybody.
different for everybody.
It's my weekends, I did not do homework on weekends. But
A lot.
I can't say that I didn't every weekend, that I didn't do something. But I was so far ahead, and I had my weekends were like my time, like to see my friends that I don't get to see because you're buried in a book or you're in clinicals or whatever. I would get my work done during the week so I could take a break on weekends. I could sleep in, I could, go do whatever I wanted to do on the weekends. That was me. But I mean, some people, it's like in school. It's the same thing in college.
Yeah.
Some people can spend 8 hours a day reading and not comprehend anything, or some people can spend 2 hours and understand everything like that. And I'm not saying that you don't need to put time into it, because you do. But some classes came easier, and once you figure out what you're doing and stuff, it's a balance, and you can figure it out. And I mean, like I said, most of my weekends I spent with my family or my friends, because I got my work done during the week. I busted my butt during the week for those 2 days, which was like, like I'm a real person, but it was worth it to me. Maybe some people like a lighter workload, work less hours during the day. Well, then that's what you do. That's what you want to do. That you need to personalize it for yourself, and you'll figure it out.
Yeah, I didn't have any weekends off. But in my defense, I'm not a fast reader. Like, if I want to read for comprehension and read for like retaining, I'm not gonna like fly through it, because I actually want to, for me, I need to actually slow it down. Okay, what am I reading? And I annotate maybe my textbooks wouldn't be good for you, because I annotate in like the margins of my textbooks too, like kind of summarizing what's going on in there.
Oh,
And
yeah.
so, like, part of my whole thing was like, okay, I'm gonna read this and I'm gonna do my PowerPoints match up with this, like, okay, now I'm gonna have a discussion with so-and-so about this, and okay, I'm gonna post here, and sometimes like we would actually take turns reading out loud to each other over Skype. So that worked for me too, like, so you're gonna read this paragraph, now I'm gonna read the next one, or you're gonna read this section and then I'll read the next one, and like underlining, you know, and then, okay, wait, pause, like, I didn't get that, did you get that? Like, and so it was more like, I don't know, it was more involved than just like, for me, than just like, okay, yep, got it, next page, you know, it was like more like engrossed, okay, I need to remember this because this is my choice, this is what I wanna do in my life, so.
Yeah. I did that too with certain things, but like like you said, you'll pick up on things easier, some things easier than others, some classes. I remember what I did in Patho, I think it was, is like, I'm just gonna use this as an example, like the chart, or like, you know, you can read the blood flow through the heart and the lungs. I wrote it out, so I understood it, like I got it, and that's how I did it. I took a piece of blank paper and I'm like, okay, this goes here, you know, so I had that, and that is how I learned that kind of thing too. I mean, there's so many different devices and so many different styles of learning that I use flashcards as well. It's what you find that is helpful, and we can tell you, I can sit up here and tell you so I'm blue in the face, draw diagrams and highlight, but if that doesn't work for you, it's not gonna work for you, and you need to figure out what works for you, and you will, it's gonna be a little bumpy in the beginning. With anything, it's bumpy, but once you know how you comprehend and how you learn, it'll be much, much easier. The first class, I'm not gonna lie, it's not hard, it's not scary. I'm not trying to sound scary, but it is